Hey Guru Nation, welcome back to theclinicaltrialsguru.com. Again, it's theclinicaltrialsguru.com. Thank you for your questions. Keep them coming in. It's Dan at theclinicaltrialsguru.com. You can also call or text me 949-415-6256. Follow me on every social network that you feel like and that you're comfortable with. Today's question, screening checklist. All right, this is good for you brand new research sites or you new study coordinators or you new research clinic owners, whatever the case may be, even CRAs maybe. So what checklist do you need? What do you need to absolutely make sure that you have in place prior to your first screening for a new study, right? So your monitor is supposed to, in an ideal world, go through these things with you at the site initiation visit. But as we all know, or maybe some of us don't know because we're new, sometimes this doesn't happen. And you shouldn't rely on someone else. You should never be dependent on someone else to tell you what you need to do. You need to be self-sufficient. You need to know what you're doing. So prior to any screening, and I might miss a whole bunch of stuff. I don't have a script or anything. I'm just going off the top of my head. You definitely need to make sure that your SIV has been completed, your site initiation visit. You need to make sure that you have IRB approval to screen, alright? So that should be in your regulatory binder. Your site should be active to screen by the IRB, alright? If you're not sure about that, call the IRB and ask them, alright? You should have an IRB approved informed consent. You cannot screen someone without an informed consent form. And then all the other forms that go with the informed consent. So the HIPAA, the authorization to release medical records. If you're in California, the California Bill of Rights. So those things go with the informed consent form. Then you need the source documents. Okay, so I've done a video on this before. You can't screen a subject, or you shouldn't screen a subject, I should say, without source documents. Where are you going to record the data? Where are you going to record what's going on? Usually sponsors don't provide you source docs, and you got to create it yourself, right? So source docs. Then you need a lab kit. You need at least a screening lab kit, where most screening visits require some kind of blood draw. So, you need tubes for those tests that are associated with the screening, and those come from the lab kits that the sponsors or the central lab should have provided for you. So screening kits absolutely needed. Most studies require an ECG, so do you have an ECG machine there? Did the sponsor provide one? If not, you're going to need an ECG. Most of the studies I've ever seen have ECGs at their first visit. Those are some of the basic things you need. Then you get into some of the technical stuff. How do you formally screen someone? Do you have IVRS access or IWRS access? That's where you actually go in and register a subject once they've signed the consent form as screened. Okay. One of the lesser important things, at least initially, it's not a huge priority until the screening visit is complete, is EDC access. Do you have access to the EDC system? Can you enter the screening data from the source into the EDC once the screening visit has been completed? These are the things you need. These are the things that I'd be looking for if I went into your site and had no idea anything about the protocol. I would look for these things, right? Because it doesn't matter what study you're doing. You go in there, you get these things, you get the informed consent, you make sure you have the approval, you make sure that whoever's doing the screening is on the delegation of duties log. That's another thing, all right? Obviously, you want to make sure the PI is there or a sub-I is there to have oversight. Lab kits, consent forms, source docs, IVRS. These are the important things for a screening visit, all right? Hopefully that helps. One final thing, if you're paying your subjects cash, if you're reimbursing them cash for their visit, then obviously you want to have petty cash on hand. If you're using some kind of payment system, like a prepaid card, you need to make sure that you have those, one, and number two, that you know how to load money onto those cards. You don't want to have the patient wait there for like an hour while you're figuring out how to do that. So you want to make sure you have these things beforehand. And then you want to make sure you have transportation for the patient. How are they going to get to the clinic? How are they going to go back? Is someone bringing them? You should know this. Is someone bringing them? Are you going to send an Uber? Are you sending a driver? Are you going to go get them? These are the things, this is my checklist that I would look at when, or right before my first screening visit for a new subject, for a new study. Another helpful thing would be the schedule of assessments. So you don't even necessarily need to know the protocol immediately. Eventually you should learn the protocol, but if you have no choice, get that schedule of assessments, and that's going to have a checklist for visit 1 of everything that needs to be done for that visit. Alright? Hopefully this helps, Guru Nation. Talk to you guys soon. Dan from theclinicaltrialsguru.com. Take care.